Let's talk of fixed options. It's always preferable for someone to have a fixed option so that you don't have to bother with, putting it in and out, cleaning it all the time, worrying about whether it's going to fall out, if it's loose, etc., etc. So in your fixed option, we have two different kinds of replacements. One is what we call a dental bridge, and one is the dental implant. For example, in this case, this middle tooth is missing. In a dental bridge, we take the support. It's literally like a suspension bridge. Think of it like a suspension bridge, where you're suspending this fake tooth in the middle with support from either side. So we have to sort of do, every time we put something on a tooth, we need to kind of grind the existing tooth on both these teeth, and then the lab would fabricate something that looks and functions just like your teeth. This is then cemented in. You have to treat it like normal, where you brush around it and floss, etc. So the pros of a dental bridge are, of course, it's fixed in your mouth, so it's far easier to clean, etc. You don't have to worry about removing it. The cons are, because in this area it's connected, you can't floss very easily here. They have things like floss threaders, etc. But most people kind of tend to avoid that. It's a lot of work. So there is a chance that you might develop either bone loss or some sort of cavity in this area. But again, compared to not doing anything, or perhaps even the removable, this is a much, much better option. Let's move on to the next one, which is the dental implant. A dental implant is a standalone unit. It is a titanium screw that is placed inside the bone. And then there is this little part that sticks out, which simulates this part of the tooth. It's called the abutment. And then we put a cap or a crown on top of it. The titanium screw is placed either by an oral surgeon or an implant surgeon, or perhaps your general dentist if they are experienced enough. Once it is placed in, it takes about 3 to 4 months for the bone around it. You see the screw has these, it's like a screw, so it has these notches in it. And over about 3 to 4 months, the bone starts to form around these notches. It gets inside the notch so that it's held very tightly. We have to wait for that to happen and for this implant to be completely stable inside your bone before we go in and load it, as it's called, before we go in and sort of put the abutment and the cap so that you can start chewing on it. While that is happening, we either leave this alone, or we can put a temporary, if your dentist feels that yours is the sort of dentition where the teeth might move easily while we are waiting for these 3 to 4 months, they might suggest like a little removable temporary denture just to hold the space, just so that these don't start to move in. The advantages of a dental implant, obviously, are that you're not grinding tooth structure. It absolutely simulates a dental tooth. It's the closest to simulating a dental tooth in form and function. And it's very easily cleansable. You can easily floss between these teeth. The disadvantages usually are financial. However, nowadays there are more and more of these Chinese implants coming in, which are obviously cheaper than the regular ones. And some of them are quite good, some of them not so. So you have to kind of do your research and see which dental implant works best for you. Dental implants are not for everyone. If you're a severe diabetic and such, your body may not be able to generate that bone that's needed. If it's an uncontrolled diabetes, it may not be very wise for us to do surgeries and such. It might actually be counterproductive, in which case we would either opt for the bridge or the denture. the point is that, like I said, no matter what, it is extremely important to replace missing teeth. Now, let's talk about teeth where you have all your teeth missing, a full denture. Now, as you age, you're losing bone every year. You lose X% of bone every year, and you will notice that your dentures are getting looser and looser. Yes, you can go in and kind of, keep adding material to that denture to make it tighter, or keep making new dentures, but at some point, there will not be sufficient bone to hold that denture. The only thing that holds a denture in place is the existing bone structure. What has now come in the market is something called an implant supported denture. So what would happen is you would have, say, 4 implants. They're placed strategically in, like, say, one in a premolar area, one in this canine area, and then again on the other side. And then they fabricate a denture that sort of just kind of sits on it. It's like stuck into it. It's a fixed kind of an option, where your dentist then goes in and screws it up from the top. This is one of the best options now in the market. Again, it is not for everyone, because you do need some amount of bone structure for us to be able to put an implant. If you have almost no bone, then the implant would be too short, in which case it defies the laws of physics, and we can't put an implant in it. So yes, so these are all the various options of replacing teeth, and the pros and cons of it. And I'd strongly urge anyone who thinks that they can function without teeth to go in for a consultation with your dentist and find out what your options are for replacing teeth.